Waiting on YouTube to go live. There we go. All right. Today's rant is inspired by the FDA and the letter F. Fraud, financial gain. I'm a little disgusted. I had a conversation with somebody on my Facebook page yesterday who's got information from Pfizer investors about this vaccine being pushed through. Like, this is a brand new vaccine with technology that we have never used before. Don't know any side effects on, but we're going to push the FDA to fast track this drug, this vaccine, to give people a false sense of security when we can't even tell you if it stops the spread of infection. Can't tell you what the side effects are either because it hasn't really had enough time to have this, hey guys, to have it been scienced the crap out of. I got a problem with that. I also have a problem with the rapid tests that are just received emergency approval by the FDA. Okay, it's going to require a prescription, so it really would only be good for those people who your doctor's telling you stay home, you don't need to leave the house to get tested. It's $50 a freaking test, which means more than likely it's also billable to your damn insurance, which drives up the cost of that test a little bit more. Saliva testing is minuscule in cost. It's more informative than a test that can tell you yes or no you were positive. The saliva test can actually tell you your viral load and if you are infectious at that point in time, so you know whether to stay home, send your kids to school. But they're sitting on this. They're sitting on it because these individuals who have created these tests are just very small companies, but they've been ready to go since February. The specificity and sensitivity has been increased on them, so it should have no problem falling within a range of approval. So now we're going to fast track at-home testing on a test kit that's really not that accurate, folks. The PCR test is not that great. And we're going to skip over the saliva tests. I have a gentleman, this is the same gentleman who shared the remdesivir and baricitinib results. Okay, that's an interferon treatment. We knew back in April that the interferon was more than likely helpful. They did not do a study, like they didn't have enough arms. I think there was only 2 arms. It was the remdesivir and the placebo, or the interferon and the placebo, and there was only 1 day difference in outcome length of stay. That's not significant. 1 day? Folks, hell no. We know that remdesivir is causing kidney damage. We can't even give it to people with kidney failure. It's very limited. It's like $1,400 for 5 doses. So we're going to, and then the WHO recommended not using Gilead's remdesivir. Like, I think it just came out yesterday or today. There's a reason for that. It's not been shown to work. When they did the interim data analysis, it showed like a 4-day change, and that was significant at the time. They got done with the study and found there was no improvement in outcomes. It did not improve oxygenation. The quotes I am seeing, I am just freaking livid here. They are saying that, I got to figure out which article this is even in. I did post the links on the YouTube video. The odds of a patient's condition progressing to death or being ventilated at day 29 was lower in the baricitinib plus remdesivir group versus the placebo plus the remdesivir. The drug that's helping is the interferon. That's why it did better than the placebo and the remdesivir. We know remdesivir alone is not helping. And then they're saying that the time to recovery, let's see, there was something about the oxygenation. Folks, the only drug that we know that has improved oxygenation is RLF 100, and that was expanded to emergency access. But you know what doctors aren't going to do? They're not going to prescribe a medication that they're not hearing any information about. All these medications and all these This is all coming from big pharma. Oxygen damn near overnight. And we're just not going to talk about this. But we're going to push all these very expensive drugs into the population and then give you a false sense of security about what treatments we have, vaccines, what we don't know work. I am not getting a vaccine. It better be 5 years before I see the long-term results of what people have suffered from a brand new technology. We've never done this before. Never. So we don't know how it works. I'm not a guinea pig. I think like our veterans already play enough guinea pigging when they have to go to the clinic every month and they screw with their meds all the time. I'm good on being a guinea pig. But this is absolutely freaking ridiculous. So if you don't question the motives behind this, like I said in my original video, I'm a Trump supporter. I do not agree with how he has handled this pandemic to begin with. He has set a very bad example on masking, and we know scientifically it does work. But I really feel like this is a last push by the administration to do something that makes them look good in the eyes of the public when it comes to the pandemic. Well, it's a little bit too late, and this is not something we should be pushing into the public because we're scared and we need to force something that might not be safe, that we don't even have all the answers to. If that sounds okay to you, I really need you to stop and think logically about this. It's all money. All the ones that are being pushed that are really ineffective are all about money. And there is a risk to using the baricitinib or the baricitinib. Like I said, these are a pain in the ass to pronounce, but it's an immunosuppressant. It's like chemotherapy. They use it in MS. They use it in rheumatoid. That suppresses the immune system to a certain extent. We don't want that cytokine storm to happen, but the one drug that we're seeing any promise with is the RLF 100, or otherwise known as aviptidil. It's a peptide that's been around a long time. Imagine how empty my intensive care unit would be here in El Paso, or all of our ICUs would be, and how many people we could get off the damn ventilator. This drug has been approved for expanded access. Nobody knows about it. Not using it. If there's a hope of getting somebody off of a ventilator or not putting them on it to begin with, they're saying that this here is our only hope in moderate to severe illness. Sure as hell ain't. I've got other drugs that are doing a far better job, and Pulmicort, folks, does not help your lungs. We have known from the beginning, we expected our COPD and asthma patients to be the majority of our patient population, and they're not. There was hardly any increase in admissions for COVID in that patient population. We believe it is because they're taking things like Pulmicort every day prior to getting sick, and it provided some level of protection. But there is no proof that Pulmicort, budesonide, or any other inhaled steroid beyond one, the one that I talked about, and that was shown, I think, in vivo. I can't remember which one it was. It's been so long. But there was only one, and it's nothing that we're talking about. That doctor from Texas back in July, we heard all about his rambling. It ain't true. It ain't true. We're not even supposed to be nebulizing medications for you. It's an aerosolized generating procedure. So to sit here and irresponsibly encourage us to nebulize something that's going to be thrown into the air and potentially inhaled is ridiculous. I don't care whose staff you were on. Doctors, I need you to freaking listen to me right now. I don't care about your God ego, your God complex, or whatever the hell else you think it is that you got going on, that you're going to solve corona with a damn chest x-ray. I don't know. But go to MCRIT. There is a complete guide on how to treat these patients. I get a message from somebody yesterday with a picture of a vent screen, actually a video, and I'm looking at these high peak pressures. The respiratory rate's at 46. Now, we know these people are breathing heavy as it is. We're using boluses of paralytics, docs. We have patients on 3 different kinds of sedations out here, and they're bucking my vent and getting peak pressures that are going to cause them a damn pneumo. And for those of you who don't know what a pneumothorax is, it's a hole in your damn lung. And my patient that passed away in Georgia that worked so hard with me to get the parts I needed to help him, that's what happened to him. He got a pneumo. It got worse. We couldn't fix him. He wound up on a vent and died like 2.5 weeks later after very aggressive. Hang on a second. So there's that. I need people to listen. Listen, doctors, listen. You don't know it all. I can tell many of you have not even done your damn research. And as a pulmonologist, shame on you. Very much shame on you. You should be on top of this crap. You should know the medications that were even being trialed in our own state that are showing approval, like 9-fold increase in survivability. But none of y'all want to listen because you think that you know everything. Most of you haven't even been out on the front lines. You're just getting slammed in the city that you're working in, and you're only filling in for a few weeks. Give me a damn break here. Apparently, it was a female doctor who didn't want to listen to a damn thing, wouldn't let the nurse paralyze the patient or anything. Well, guess what's going to happen to that patient after bucking my ventilator for hours at high pressures? Pressures of 50, 60, and 70, folks, are not okay in your lungs. It's a great way to drive a nail right through them. You cannot do that. That's the damage we know we were causing from the freaking get-go with these damn ventilators. And to sit here and hear this crap from nurses, other RTs from across the damn country does nothing more than piss me off because I got an ICU city full of ICU beds that are full, and we could be getting these people off of bed, but you don't want to listen. I got a problem with that. Start doing your research. You can start with PalmCrit and MCrit because these guys, the guy from MCrit's out in one of the large New York City hospitals. He's pretty much come up with the guidelines on how to treat this because they were the first ones to deal with this crap. I don't know where you're getting your information. High peak pressures, APRV, bi-level, it's more damaging. We need low volumes, low pressures, faster rates. A tidal volume of 500 in somebody whose lungs are stiff, you're going to cause them more damage. I've already had to rip ambu bags out of doctors' hands. That's the thing that Luana's claiming we're not doing with patients is bagging them. Well, that's like a liter bag. So that's 1,000 mLs. That's double the volume that the ventilator is normally giving. And you're just going to pound that into a patient's lungs and not understand what you're doing? If you don't know what you're doing, then you need to consult respiratory, a pulmonologist, an intensivist, hospitalist. They have no idea on vent management strategies. Start utilizing your specialist a little bit more because we're the ones out here staying on top of shit. So you can stay in there and work. I'm just disgusted with this. I'm absolutely disgusted. Yeah, they probably will try to force us. Yep. Veterans are the government's. That is, yes. And you should know, my dear. That came from a veteran. Yes, big business and the government are screwing with our lives. It makes me, yes, me too. Me too. Because this is affecting our patient population. And now it's across the United States in almost every community. The numbers are skyrocketing every single day. And to not use these therapies that we know are working because the media doesn't determine the election. The media doesn't determine science. Open up the New England Journal of Medicine, the British Journal of Medicine, JAMA, the Journal of American Medicine. I mean, all these studies are published in there. It's up to you to maintain your credentials just as much as it is mine for continuing education, and shame on you all for not doing so. So for those of you who have loved ones on a damn ventilator, RLF 100, and if you need the data, make sure you get a hold of me and I'll send you the clinical trial information. Because if your loved one is suffering on a vent, ECMO was another thing. Well, why don't we have more ECMO? It helps people. The goal is to keep you off of ECMO. ECMO is a last-ditch effort to keep you alive. And all the complications that we see with the high comorbidities of complications are what we see with corona. Most of these people need a lung transplant by the time they get to ECMO. So now we have to wait until you test negative, even if your body is shedding the virus and it's inactive or not, they're making you wait, and then they'll put you on ECMO. But we only have so many ECMOs in this state. In many states, there's not many, folks. Some hospitals only have 2 or 4 beds that can do ECMO in an entire state. The goal is to keep you from progressing to that point, get you home with your family. So these arguments that I'm hearing are completely backwards. You're going to start getting a lot of more information from the media. Turn it off. Turn it off. If you want to see the science, you come find me and I will give you the data. But you need to look at the actual data and don't let somebody on a freaking news show tell you what it is. Dr. Oz is a sellout. Dr. Phil sold out a long time ago. All these doctors that you see on TV, no, because they're all about big ratings, big money in their pockets. I don't care if they're still practicing. I'm not happy because this is going to add to more confusion. People are going to think we're withholding treatments that haven't been proven to work. Do not harass your doctor to give your loved one remdesivir. RLF 100. Long R word. I just can't right now. I am just disgusted with the FDA, and it's only going to get worse over the next few days as Pfizer and Moderna are probably going to push their vaccines. Folks, ask questions. Don't just accept what the media is telling you. There is no data to analyze. There's no peer-reviewed studies on this vaccine. The only studies that have been done have been on us healthcare workers. Start asking the right questions, please. And when it comes to big money, big pharma, high costs, you have to start to wonder why. If we have all these other options and we're not using them, the question is why? And I guarantee you it's going to lead you to money every damn time. Which upsets me greatly because this is one of the things Trump was supposed to put the brakes on, this big pharma profiting off of people. He's advocating for it now as far as I'm concerned, and I have a problem with that. These drugs are not cheap. Chemo, not cheap. Remdesivir, not cheap. RLF 100 is synthetically made a hell of a lot cheaper, and it's been around for at least 20 freaking years. And we have data on it. Can't think of a reason not to use this drug. Yes, Kurt, you are exactly right. Barbara, I will definitely send that to you. I posted it it's in the link to the post on my page that Thomas had put on there about the remdesivir and the baricitinib being approved and fast-tracked for no damn reason. Like I said, the WHO just recommended against using remdesivir. I understand you got a problem with the WHO, but it is the World Health Organization and not just our CDC. I trust the WHO more than I trust the CDC right now. At least the WHO is going off of data and science, none of which remdesivir has. So please do not force doctors to give your family that drug. Yeah, I'll still share it again anyway on the videos. I do have to go and find it. I did spam this poor guy with data, but I'm good for that. You all know it. I just can't handle, and I've been, here we go. I will post it in the YouTube links as well over here, and I'll also post it in the description when I get done. But this is the one about remdesivir and interferon not working. It's the WHO recommendation. Yeah, they fall flat in the WHO's mega study of COVID treatments. And this was back in October, guys. It's been a month. Told you this a month. And I've been telling you all along we haven't seen anything with the remdesivir in the patient population in the hospital. And a pulmonologist who's doing 2-week rotations, it ain't going to see jack crap either. You need multiple months of witnessing mass amounts of death and patient patterns to even grasp this. But it should be criminal. And the thing is, Kurt, RLF was granted expanded access, just like this stuff. But these doctors have no clue about any of it because it's not being promoted in the mainstream media. Like the only article even the city of Houston wrote about it was in the very beginning when they got the guy off of ECMO and a few other patients off of vents and discharged and turned around in miraculous time. But you write one article about it in the local news? WTF? Start asking yourself why. I'm pretty sure Big Pharma's lining the pockets of mainstream media and a lot of other investors right now, and they're trying to make money off this drug to mute anything else that could actually help us and help my city, help families across the United States. It's a 3-dose drug with the RLF 100. Remdesivir is 5. I mean, hell, this is ridiculous. I have some folks I want to talk to. Just are myself. Yeah, you are best. I understand that, but you have to remember, like the one that was just done with the interferon and the remdesivir was only 1,000 patients. If you pull up a statistic calculator and you're looking for a percentage of the population that you want to sample results from, 11,000 is actually quite a bit. I did this on my how to weigh the credibility video. I went through all the calculators and everything and showed the difference. And it's with like a plus or minus. You can adjust a point, a plus or minus, but the patient population is actually pretty small that is needed to represent that many people. But the WHO is the one that did the study initially on the remdesivir. So if you look back at just the interferon results, they were already promising. You didn't need to add a drug that's killing people's kidneys into the mix. Back at the time when they opened up that study with the baricitinib, it was because we thought remdesivir was helping, so they decided to try. But this is why, like, more than 2 arms in a study, like just a plain placebo and just plain interferon would have been a great thing to compare all that to. But we didn't do it that way. But we didn't know back in April either that the data was wrong. This is why interim analysis, this is what they did with the COVID vaccine. They did an interim analysis on each vaccine and found all these miraculous things. But what happens 6 months from now when the same crap that happened with remdesivir happens with this vaccine? Fast tracking these things is never, I don't care who it's going to say, but when we don't have the kind of data that we're looking for, it's really important to make educated decisions based on your situation with this, because I'm sorry, this is all about money, and it's hard to deny at this point in time. It's not about us getting paid more in the hospital because you were diagnosed with corona. We have more labor. We can see less patients because it takes us more time to garb up and do all this stuff. Ventilator length of stay days is 3 to 4 times as high as normal. There's a lot of extra cost that comes with these patients. The doctor isn't getting paid more money. The hospital is. They pay us pretty much the same amount or not cut our pay. which is why I decided to travel. But you have a lot of these permanent employees working on the front lines that aren't getting paid anything more than their basic pay. And that's a damn shame because this is hazard duty. It's hazard pay. But you have all these things going on, and nobody's asking the right questions here. And this is why the medical professionals who are doing their research really need to start going, hey, do you know how many mainstream media outlets aired anything? Every interview that I did, I talked about RLF 100. Did you hear anything about it? Nope. We're just going to gloss right over something that can help the community. Can't do it. Thank you, Sandy. I'm at 13 more days. I logged into my account. I got that video out yesterday, and then it locked me out and banned me for another 13 days. So at least it's not till the end of December. It's just 13 more days from today. So I'll be doing on this one for a little while longer. But I do want to, I did get some messages. One of them was, I've listened to your video on what's happening in our hospitals. It's just unbelievable. Thank you for what you do to help save lives. I would like to ask if you have any advice on how I can convince my husband that going to a Thanksgiving gathering is really a bad idea right now. Personally, I won't be attending. My husband works on the other side of the state, and I know he really misses his kids and grandkids, but I feel it's far too dangerous at this time to do get-togethers. Any advice on how I might be able to convince him not to do this would be appreciated. He is aware of how bad the situation is in El Paso now. He has also lost 2 cousins to the virus. Update, my husband's company has decided not to allow him to travel to El Paso, so I guess the problem kind of solved itself for now. It might be a good video for you to do, though. I'm sure many people would love advice on how to talk to their loved one on this issue. She has a great point. We do have people who just don't believe in it, even ones who have lost people in their own family. This is not a joke. If I have nothing out here to treat you with successfully, and then you want to spread it to family members, I'm glad that his company didn't allow him to do that. But I would definitely be like, nope, we're boycotting. You know, you're not taking the kids over there. You're not, I'm not going. If your family can't understand that, then I'm sorry, but this is a global pandemic right now. This is not just affecting just our city. It's not a measles outbreak. I mean, this is killing people and overwhelming. This is, even with H1N1, I was graduating college when H1N1 came out. We were not dealing with this, folks. This is not the flu. The flu kills 3 times more people on average daily. Excuse me, Corona kills 3 times more people than the flu on average daily. I shared that graph. 900 and something to 300 and something. So comparing it to the flu and the infection or case fatality rate, your math is wrong. You can pull those numbers any way you want and make them reflect what you're looking for, but you're not accurate. Another one is, I have seen a video of a response to the travel nurse. I tested positive for COVID back in October. My husband and I isolated up until November 7th. I'm scared to get COVID again since my husband is back to work. We have an 11-month-old infant, which my mom takes care of when I'm at work. My mom has just finished her chemo due to breast cancer about a week ago. My concern is it's safe for me to take my daughter to her. I'm just so terrified. I don't even want to look at the news anymore. And I advised her, don't, because all they're going to do is put more fear into you. I don't even want to, but I understand I have to educate myself. I appreciate your time. God bless. And I did tell her that even though she's not at risk right now for reinfection, we do know with those antibodies, about 3 to 5 months right now, you have immunity, which is why this immune vaccine, you don't know if you're going to need a booster in 4 or 5 months. We don't know. We're going to have to keep drawing people's samples and seeing where antibody levels are at. We don't know. So I did advise her, since, you know, that she would probably still want a mask, because if she just finished chemo, mom is probably immunocompromised, so she's susceptible to getting just a common cold or anything. since they aren't infectious or contagious anymore, I'm not worried about that part. I'm more worried about immunocompromised mom, and the baby didn't get it. So she could be a carrier very easily to grandma. So masking is always very important. And then I keep hearing people don't travel for the holidays. Traveling is probably not a good idea unless you're doing it by car. If you know that your family has been quarantining and isolating and you've been being responsible, this is the key word here, folks, responsible. If you've all made a family agreement, like, okay, we're not going to do anything for 2 weeks prior to Thanksgiving, that way we can make sure we have a great family get together, great. Quarantine, isolate, stay away from other people, and then go spend time with your family for the holidays. Screaming and hollering at people to stay home, don't travel, what are they going to do? The same thing a child does when you tell them no. They're going to do the exact opposite. So you give them the tools that they need to be successful and do it right and educate. There was people all over. Shelby, one of the girls who had done the interview with me for KTSM, she had posted a great risk activity thing over the holidays. I saved it. I do need to repost it, but it had like a risk level, like, okay, singing in a church choir indoors, really high risk. Outdoors on a hayride, much lower risk. I mean, if people can understand the similarities and the risk factor, they can make better choices. People are laughing, oh, this is fear mongering. We do risk management every day in the hospital. We have disaster planning, so that way if there's ever another 9/11 or something like that, we are prepared. We have a contingency plan. It's not like the Rona in the middle of a pandemic that nobody has any experience with. So there's that. So very important to do things responsibly. I do not advocate shutting down. I do not advocate not traveling. I do not advocate avoiding your family at all costs. I advocate doing things in an intelligent manner, responsibly, and with great deal of social responsibility. And if you can't do that, then stay home. Some of you can't. I can tell by your attitudes. Just do us all a favor and stay the hell home. I would like to say I should read the Samuel L. Jackson of Stay the F Home. It was just shared to me again, but I shared it back when it came out. But it's very true. If you can't do it, stay the F home, please. We don't need your help out here, adding to our patient population. My hubby's, oh, there's Mel. Hubby's sister can't breathe when she lays down or when she sits up. She can't breathe good. We keep telling her to go to the damn. She needs to start proning. Has she done that? Laying down face? I don't care if it's uncomfortable, but you just let her know that we're going to do it to her on the ventilator anyway. So if she doesn't want to do it now to improve her oxygenation and breathing, I'll be happy to deal with it on the vent. But, yeah, I mean, you can't force somebody to seek treatment who doesn't want it unless they're so obtunded and altered mental status, then you can force the treatment on them. But as long as she insists on behaving this way, she's an adult and can make shitty decisions, unfortunately. And I told you yesterday, stay away from these people because it sounds like you are surrounded by a bunch of idiots. Yeah, and that's the thing. Most people, they have a problem wearing the mask, but they will wear their seatbelt and they don't smoke indoors anymore. But this mask is a huge issue. And yeah, they can't take any social responsibility. So I'm sorry, your personal freedoms and liberties are going to have to be restricted over a piece of fabric because you want to act like a 2-year-old. Actually, I know 2- and 3-year-olds who behave better than these people do wearing masks. I'm just disgusted by it. But that is my rant for the day. F the FDA. Start asking questions about why all these other therapies aren't being utilized, especially saliva testing. It's because they can bill your insurance and charge money. Doctor's prescription has to be written, but yet all these COVID testing facilities, You don't need it, but it needs a prescription because they're going to try to bill your insurance. Yeah. No. If I can buy 100 test strips for less than $5 and test my whole family every day and know whether we have a viral load of exposure, a viral load of it's on the incline, it's on the decline, we can tell what part of the course of the disease process that you're in by just those little saliva litmus strips. Start pushing your lawmakers, folks. Get a hold of your reps, get a hold of your senators, and start asking questions because this is wrong.